Okay, everybody. Welcome tonight to the Postgrad Info Evening. You're in the room here, which is serving the Master of Professional Practice, the Graduate Certificate of Lymphedema Management, and the Graduate Certificate of Clinical Trial Operations. My name is Verity Pacey. I'm the Associate Dean for Graduate Health Education. And we have here Louise Koelmeyer, who is representing the Graduate Certificate of Lymphedema Management, and Rania Salama, who's representing the Graduate Certificate of Clinical Trial Operations. It's the three courses work together quite uniquely. So we're going to present a brief overview of each of these courses. And then what we'll do is have plenty of time for questions. For those of you who've come into the room already, if you could pop into the chat if you have a particular area of interest out of these three courses, that would just be helpful for Rania, Louise and I when we're spending some time presenting and when we get to questions. Please do feel free to pop questions into the chat at any point in time during the presentation. We'll be speaking for about 15 to 20 minutes, and then we'll have plenty of time for questions from everybody as well. So what we might do is get started. So we're going to start with looking at the Master of Professional Practice. This is a brand new degree which is commencing with us here at Macquarie University in 2025. It's set up quite specifically to encourage people who are working professionals in the field of clinical trial operations or lymphedema management to have an opportunity to gain your specialisation in the skills from some coursework units and to then really enhance your clinical practice and your research skills while working out in the industry as well. So what I'll do is I'll take you through briefly the Masters of Professional Practice side of things, and then we'll get into the specialisations. So if we head on to our next slide, we'll run through that course overview now. The course is held in the Faculty of Medicine, Health and Human Sciences, where we're all located. It's an AQF level 9 as a master's degree, and that involves 80 credit points, which is delivered in 8 10 credit point units, 40 credit points being essential, which is where you work on your clinical practice and your research skills, and 40 credit points is your specialisation. So it's 4 lots of 10 credit point units for the Graduate Certificate of Clinical Trial Operations, and you have 8 5 credit point units, which are micro-credentials as well, which Louise will explain, as part of the lymphedema specialisation. It can be done over 1 year full time, but the majority of people we are expecting to do this part-time, as we are expecting most people will be part-time professionals taking part in this. All of our units are delivered in different ways. So primarily you have online content with some practical components, particularly in the lymphedema units, whereas clinical trials is wholly online for the specialisations. The 40 credit points that we have after that can be done online or with some time for you as well. So if we move on just to what we're aiming for you to achieve as part of the Masters of Professional Practice is to meet our graduate capabilities that we have here within the faculty. So at the end of the degree, we expect you to be a scientist and scholar, so that you'll be applied scientists, research informed, with a broad range of knowledge and skills relevant to your area of specialisation. As a practitioner, you'll have effective communication skills and be highly skilled to deliver safe and effective contemporary evidence-based professional practice. Then using those skills and that knowledge and applying them to different contexts, we're aiming for you to be an engaged global citizen, where you'll be inclusive, culturally respectful, and aware of the healthcare systems and the research-based systems that you work in, to not only be able to apply those skills locally, but also, where necessary, globally. And finally, for success in your careers, we're aiming for you to be a professional, an ethical and reflective professional practitioner who can work very effectively and collaboratively within teams and direct your own lifelong learning, because your steps at university, whether it be micro-credentials, units, or the whole degree, are only one part of your ongoing professional development within your area of interest. So if we pop on to the next slide there, the 2 units, if you do move into the Master of Professional Practice, one is Research and Practice and the next one's Advanced Research and Practice. So as part of that, you'll be learning about research skills within your area of specialisation, and you'll have a mentor, so an academic mentor from the faculty, to help you enhance your professional practice in the context of your workplace. You can then bring your work-based skills and your new research skills together to pull together a research project plan. This is a small-scale research project which hopefully can be embedded within your own workplace to help you build your skills in that space and to try and improve the outcomes for your patients, the outcomes for your research participants, and the outcomes for the staff and the organisation itself. You then will pick up that project and actually start to carry it out within your advanced research and practice unit. So this is why for many students, we anticipate part-time will be the preferred method of study. Again, you'll maintain your work with your mentor, you'll bring it all together, collect some data, and have ways to then disseminate that, whether that be through writing what could become a manuscript, presenting it as a poster, or presenting in oral presentations. As part of that as well, we hope that you'll be able to reflect on your learning throughout the whole degree and put together a portfolio which then might be able to be used to help demonstrate your competence and your abilities within one of these areas of professional practice. So if we move on now, what we will do is I'll hand you over to Rania, who will talk you through the postgraduate specialisation within the Masters of Professional Practice, which is also the Graduate Certificate of Clinical Trial Operations. Thanks, Rania.
Thank you, Verity. Hi, everyone. I'll give you a quick overview about the Clinical Trials Operations Graduate Certificate and Specialisation of the Master of Professional Practice. So why would you take that course? Working in the clinical trials industry allows you to have an impact on patients' lives, bring new treatments and intervention to the market. There's a skills gap currently in the market, and you'll be able to accelerate a career in plenty of job vacancies and opportunities. You can grow vertically or laterally in the industry. And there's also something for everyone. So join an industry with roles in different natures. So there are patient-facing as well as data management and more desk jobs. So working in the clinical trials, you can work for pharmaceutical companies, diagnostic companies, medical device companies and manufacturers, contract research organizations, as well as clinical trial sites on hospitals, medical research institutes, government organizations like the TGA as a regulator of the medical device and medicines in Australia, as well as other opportunities as well. So the course is developed with an employability focus. So you would acquire the qualities, knowledge, and skills required in various clinical trial operations roles. The course is co-designed with industry experts and clinicians. You'll be able to utilize your learning content and assessments to showcase the employer, as well as there are various career options and opportunities out there. So why take this course now? So there are currently efforts for developing a national competency framework for various roles of clinical trial professionals. The good news is that all these frameworks and proposals are built on the International Joint Task Force for Clinical Trial Operations Competency Framework. And this course at Macquarie is mapped to cover this same framework. It's obviously a recognized university qualification. The graduate certificate is AQF level 8 on its own. And if you upgrade to the master's, it's AQF level 9. It's a first course of its kind, so you'll be ahead of the game. It's supported by various pharmacy and device companies and contract research organizations. Fully online course, and you can do it part-time as low as 1 unit per session. Or per semester. It's fee help is available, and you can continue after the graduate certificate to do the masters, and after the masters you can do other stuff as well. So what will you study for the graduate certificate of clinical trial operations? These are the 4 main units. You start with the foundations of clinical trials as an introduction into the industry and the drug development process and the different roles and how things work and how ethics work and what are the guidelines that govern the industry, and as well as the good clinical practice guidelines. Then you go into the clinical trial operations where you learn in more detail on how the clinical trials data are collected and how they are monitored and used. Clinical trial management, you go through the whole life cycle of the clinical trials, and you see how different aspects are managed from the pharmaceutical company or from the sponsor's perspective, as well as from the site and the patient perspective. And then you go into the advanced clinical trial skills, where you learn about the more innovative ways of doing clinical trials. So all this is done through online interactive materials, relevant resources that are put up to you, pre-recorded bite-sized experts, videos, whether the clinician or people from the industry, knowledge checks and short scenarios, weekly online live Q&A for any questions that come up, and especially when you come closer to the assessment dates. So it's you're studying online on your own pace, but at the same time, you always be able to contact the teaching team. Peer interaction or discussion forums for networking, and or the assessments are all authentic, or what we call the workplace-related assessments. And I'll just spend the next slide to introduce to you how assessments work. So there are only a couple of quizzes for for the good clinical practice and dangerous goods handling certification requirements. Otherwise, they're all case studies, oral presentations to different audiences, clinical trial related documentation, for example, preparing an ethics application or participant information and consent form. There's also the viva or the oral examinations for different scenarios, cultural issues, and employability skills. So across the clinical trials life cycles, clinical trial professionals can be in any of the roles that you can see on the screen. So at the start of the trial, there's a sponsor side where they prepare things for the clinical trial. So before the trial starts, and in their startup or regulatory team. And the sponsor, when I say the sponsor, that's the pharmaceutical company or the device company. Or you can be at the site, which is a hospital or the clinic, where there's also the startup and regulatory team preparing documentation for ethics and governance documents, as well as the budget and negotiating the budget with the sponsor. When the study starts, you can again work for the sponsor as a clinical trial administrator, as an entry level, then the clinical research associate or the monitor who oversees the trial with the site, and then you can go up the ladder to be a project manager. On the site or the hospital or the clinic, there's a clinical trial assistant, which is the entry level, clinical trial coordinator, which basically deals with the patients and collects the data from the study visits, and then the data quality associate who makes sure that the data is collected properly and accurately, as well as the pharmacist, the nurse, and the investigator, obviously the doctor. After that, the sponsor collects all the data and works with the biostatistician and the data manager to present that data to the community and to the regulator. So I think this is my last slide, and now to you, Louise, for the lymphedema management.
Thanks, Rania, and hello everyone, and thanks for joining us tonight. It was great to see many of you at our recent national conference in Adelaide, and some of you may have received notification from our alert program. Thanks, Rania. So I'm really excited, as many of you know, to be launching, I guess, the postgraduate certificate in lymphedema management. So if we just move to the next slide, Rania. So I know many of the names that are on this call, so it's great that you're partnering with us and continuing the journey with our alert program. I think you know we're the Australian Lymphedema Education Research and Treatment Program. It's a long name, so we're known as the alert program, so you need to stay alert for the next 10 minutes or so while we go through what exciting changes we've got in our education program. Our mission in alert is very much about delivering evidence-based education to really improve the lives of individuals at risk of or living with lymphedema. And we have a multidisciplinary team within our alert program across the three arms of our program, thanks Rania, across education, research and treatment. And some of those faces on there you're aware of, and I'm really proud of the team that we've created and feel very privileged to be the director of the program. Thanks, Rania. So, lymphedema management, many of you, I think, are already accredited lymphedema therapists. So you've either studied with us with Alert to get your accreditation to be able to work as an accredited lymphedema therapist according to your scope of practice and discipline in your area. There's so many areas that we can work in as lymphedema therapists, and I've just listed several of them here. Can work in multidisciplinary cancer settings, in cancer rehabilitation, setting up a multidisciplinary or allied health lymphedema program. You can be involved in the prospective surveillance and early intervention model of care in a whole range of cancer areas. Chronic edema management in the community and also aged care edema management in the community is certainly a growing area. And also the lipedema or lipedema management is a really hot topic internationally with growing research and growing management options. And many of you also may also have a little taste for wanting to do some research in this area. And I think as clinicians, you're really well in a great spot to be able to answer some of the clinical questions that you might have in a really well-supported research team as well. So the possibilities are endless to work with us and to do this postgrad cert. Thanks, Rania. So why take this course, as in moving from the micro-credentials that many of you have undertaken to a postgraduate certificate? So I guess the impact is obvious. It's really about making a positive impact for individuals at risk of or living with this condition, either lymphedema, lipedema, chronic edemas in our community. This course, I hope, will really accelerate your career by supporting you as a specialist clinician. Many of you already have the ALA accreditation as a lymphedema practitioner, but I know there's many out there who want to be considered and recognised as specialist clinicians in this specialist area. And I'm really excited that we can offer this course. And my understanding is there's only one other university in Scotland who are offering any formalised university program. So let's see who can be our first graduates of this postgraduate certificate. And I think working in lymphedema, there's just so many opportunities to work across public, private health settings, and also community and multidisciplinary settings. So the opportunities are endless. So what you will study. Now, some of you I know on this call have been part of our program and see the growth over the last few years. So since 2021, that's when we completely redesigned our accreditation program under a micro-credentialing system. And these are the 9 micro-credentials that some of you have undertaken, some of them. You might see there that we've just added and awaiting final approval of management of lipedema. But you'll see there we have principles of lymphedema management, contemporary evidence in lymphedema management, then our 3 body regional units, lymphedema practice for the upper limb and breast, for the lower limb and genital region, and for the head and neck region. And then our additional specialist units on management of wounds in people with chronic edemas, professional practice in lymphedema management, wellness during cancer treatment and beyond, and management of lipedema. So out of those 9 units, there will be 8. They're all worth 5 credit points that you will be able to complete 8 of them for the postgraduate certificate. So in Rania's clinical trials, the units were 10 credit points. Ours are 5 credit points to complete a total of the 40 credit points. Thanks, Rania. As you know, for those who've completed some of our programs already, we have an interactive online program. With the 9 units that we have as part of the postgraduate, 4 of them have a face-to-face component and 5 of them are completely online. And we've done that to try to be really equitable and accessible for people outside of Sydney, outside of Macquarie University. And we know that students come to us from all over the country and New Zealand. And we're really excited that we can try to avoid you having to come additional times for face-to-face components because of the interactive online content that we've developed. So we do have quizzes, we have interactive knowledge checks, online discussion forums. We have a lot of case studies, both in our online and our face-to-face programs, based on real life, they're de-identified cases, but all of the case studies that we use across our whole program are used on real life cases that we have patients coming into our clinic who have given us permission to use their situation. We are very proud of the clinical skills videos that we've professionally had filmed. I think we have 40 videos where, again, we've used real life patients who've given permission for us to demonstrate the clinical competency skills that are required for us as an external ALA accredited provider, but for you to have access to these so you can practice them before you come in to do the face-to-face component of the training, and just to make your learning easier, that you've got this as a resource so that you can look at it as part of the embedded in the online learning, practice it while you're doing the face-to-face, and then you do have access to it for a period of time after you've been with us as well. So these are a great resource. And then we have, as many of you know, we have some VIVAs or oral written examinations as well, both through our online component and also in our face-to-face component of our course, because it's our responsibility as an ALA accredited provider that we need to acknowledge and assess competency, because it's our responsibility that you're going to be a safe and effective practitioner when you go out into treating your healthcare patients in your own setting. Thanks, Rania. So these are just some images of some of our online learning, some of our team there, our videos, our interactive quizzes that you might have to do, the clinical skills and the whole component of the online there. And then if we move to the next slide, we've got some photos of our practical face-to-face. So we work in pairs often during the face-to-face skills and really have our staff-student ratio so that people can get really specific personalised feedback. We use the videos in our practical session as well, but really the skills that you need to be an effective, confident and competent lymphedema practitioner after completing our unit. Thanks, Rania. So one of the really exciting things, I think, as part of launching the postgraduate certificate is that we're going to be considering recognition of prior learning. And what that means is we're going to be looking at students who have perhaps become an accredited lymphedema therapist before 2021 with ALERT. We want to go through and map the learning unit outcomes that you've done in those prior courses, and we have all of those from ALERT. We will be able to explore those that people have done accredited programs in other training providers so that we can map to see how much recognition of prior learning we can give you in order to then come in and do our postgraduate certificate. We certainly will look at experience as well, clinical experience that people have done. And I believe, and Verity, our Associate Dean, is the expert in everything that matters curriculum-wise through the university, but I believe that people can apply for up to 50% of recognition of prior learning. So there are requirements. It's a formalised university course, but I've got our email address there so that if you're unsure or you have a query that you want to ask us, whether tonight or email our team so we can really look at individual circumstances. So thank you for your attention, and I hope we can have some discussion and questions.
Thank you, Louise. Thank you, Rania. I'll just clarify on that point, and we can stop sharing, I think, Rania. That would be great. That it's 50% from non-Macquarie delivered education providers can potentially form into your RPL. So if you've done all of your training through ALERT, all of that can actually come across as Macquarie-based training where it meets exactly the same as what we have within the course now. But if you've got your ALA accreditation through an alternate course, it could be up to 40 credit points. As Louise said, she and the team are in the process of looking at mapping of previous courses which have been delivered through Macquarie, and it's only through looking at what content you've covered in previous courses that we can then give you a really clear answer as to what maps and what doesn't map. But that's certainly a process which the team are really happy to do. And the more that we look at that, the more we'll have easy answers for people in the future, because we will have seen what people have done and be able to just assure that it's meeting the same unit learning outcomes that we have here at Macquarie. We have lots of lymphedema interest in the room. I'm not sure if we have clinical trials interest or not. We will see. No one has posted a question yet. So if anybody has any questions at all about any portion of those 3 courses, which are very intertwined, please feel free to either pop it in the chat or raise your hand and you can ask the question yourself, whatever you would like to do. We're very happy to answer whatever people would like to know.
Don't be shy, people. I know who you are. So turn your microphone on if you want to ask a question.
I have a question for you, Louise. Yes, I've asked you this before. It's okay. I know that you haven't delivered all of your units yet. So lipedema is a brand new unit, which we're just getting approval for now. And there's one other unit you haven't delivered yet, right?
There's 2 other units.
2 other.
And so professional practice is being just in the final stages of review now to be able to be rolled out in second session this year. And then the other one, wellness and cancer, we're looking at that in the second half of this year as well. So that's in development mode. Professional practice will be out first. And then lipedema, which we're really excited to be able to offer, we're looking at early next year to be able to deliver that.
Okay, we've got a couple of questions coming in. So I'm just going to start at the top and work through them. So the first one is about whether or not the masters can be done part-time. And the question is absolutely yes. No matter what your specialisation is, that can actually happen. The 20 credit point units, which are the research and practice units, are for delivery over 1 session. That's around about a 4-month time period. But it's quite flexible in how we go about doing that. Again, it's not scheduled classes and those sorts of things. This is a new degree. If people have an interest in potentially even doing 20 credit points over a longer period of time, we can take that away and potentially put something in to make them full year units. So you could do your research component over 2 years of 2 20 credit point units if you would like. Otherwise, certainly doing 20 credit points one semester and 20 credit points the next is absolutely an option, and probably what we are sort of anticipating most people will want to do. So part-time,
if I can make a comment, Verity, that Verity, as the Associate Dean of our faculty, has heard a lot from me over the last few years about us trying to recognise people who have done qualifications elsewhere, and I want to support you all to recognise that you can still upskill with our postgraduate certificate to really help your recognition in this sector. I know I can see Jan there, and Jan is the person, Verity, that I always talk to you about.
Ah, got it.
So Jan is a massage therapist with over 20 years experience, an accredited lymphedema therapist recognised by the ALA. And certainly I spoke to you, Jan, and a group of your fellow massage therapists at the ALA saying that we're really keen to be able to support you to be able to work towards getting this. And I think a university language that someone who doesn't have a degree, a bachelor's degree, to enter initially into this, that we would be looking at the lymphedema accreditation program that you've done elsewhere and 8 years of clinical experience working in lymphedema. But I did see several of you at the ALA conference recently who already have or nearly have 8 years of clinical experience. So please be with us, and you could still be doing the micro-credential units to build up while you're still working towards that 8. So it's my goal really that a lot of the lymphedema program are working in the micro-credentialing space so that you could do a micro unit each year or each 6 months, whatever works for you as part of your CPD and ARPA recognition, and to get your normal registration. And then when you've either got your 8 years for a massage therapist, then you could certainly trade it in for the postgrad certificate.
I might just add to that as well, in terms of time frames, in terms of your prior learning, it has to be within the last 10 years for it to be considered within RPL. So if you're looking at, if you've done a previous ALA accreditation course and that was over 10 years ago, it would only be through an experience-based pathway that we would be able to provide that kind of one-to-one yes, you've done this unit, but yes, you have all of this experience, which equates to the same level, along with having your accreditation as well. But we are very, very open, like Louise said, to trying to make this work. We see the specialist skills and research that we have at Macquarie in lymphedema, and what we're able to do to support you all as practitioners in furthering your education and your skills and your research base there is only going to help patients out there as well. So we want to make this work for all of you. So if you're not fitting a box, talk to us and we can see if we can make a box fit you. Okay. Yes, Jan.
Thanks, Louise. I really appreciate your support over all these years. So thank you. Yeah, my career has been a long time, so I've got lots of bits and paper, and I need to consolidate that. How do I go about presenting to you, Louise, in a format that is going to be easy to understand, that you can see and sift through that and see what accreditation I might be able to get?
So as I've said to you, Jan, you're going to be a little bit of a test case with me. And that's where I will be looking to Verity for her guidance and support. So we will need to look at your other previous training and qualifications and look at the content of those and the learning unit outcomes of those courses and certificates that you've got, to see how they slot in and meet the same learning outcomes of our units, and then work out how much recognition of prior learning we give you, and then how many other units you may have to do of ours. And I know you've already done some anyway to meet those 40 credit point requirements. So really happy to work with you.
We have a set form here at the university that if you were to enrol, you would need to complete. And I will just put a link in the chat for people, which gives some information about what RPL is. But we are hoping, as Louise said, that we can work with you before you actually go submitting this type of form, because the form's going to go to Central and then it's just going to come down to Louise and the team anyway, right? So if we can help you get the right information in there and present it in the right way, it should be more beneficial for both you and for us as well as part of that.
Yeah, I would really stress that for those, particularly in the early days, while we're getting the support of our Central University who manage this, to understand the complexities of what we're trying to do here, work with us and work with my team.
Okay, I'm going to move down a couple more questions here. So, Louise, is there a benefit of doing professional practice over contemporary evidence topics?
So, contemporary evidence is part of our accreditation program. So, whether you're doing upper limb, lower limb, or head and neck, to become an accredited lymphedema therapist, contemporary evidence is one of the compulsory units that you have to do. For anyone who's trained elsewhere to do their accreditation as a lymphedema therapist, contemporary evidence will be one of the compulsory units that we will get you to do with alert, because that's really our latest evidence. Some of the evidence that I presented in Adelaide recently and our team have presented that are really having significant clinical implications. So that will be one, and I had it in bold because it is one of the units that we will want people to do if they haven't trained with alert.
And then that question's from Olivia, and she said, thank you already, Louise, which is great. Olivia, you've also asked about if you need to be in Sydney to get the certificate and attend a graduation. When you've gone through the process and been awarded the degree, you then get the offer of coming to Sydney to the graduation ceremony. But if you choose not to do that, they send the degree out to you. So you still get the certificate there. We hold graduation ceremonies normally 3 times per year, kind of March, April, around June, July, and then again September, October. So you can always defer if you want to have a Sydney trip, if you're located somewhere else, and you can come to a future one. Or if you choose not to, then that's no problems. We can send it out to you and you still have the award, and that's completely fine. So going to, I hope I'm saying this right, Roshan's question around the recognition of prior learning. As Louise has said, if it's a course which isn't a Macquarie course that you've done, then it's probably best to send something through to Louise's team and she can have a look and see what information they can give back to you. Do bear with us though, because we are learning. This is the new process for us with this degree, but we can certainly start that process and see what we can come up with. Christina has asked if the postgrad certificate is the same as honours. It's the same Australian Qualifications Framework level. So honours is an AQF 8 and a grad cert is an AQF 8 as well, which means you're at the same level of learning, but it's a different type of degree in terms of being the graduate certificate. Typically, honours are longer time periods of degrees as well, and they're more research-based, whereas the graduate certificate has the coursework and clinical practical skills as part of it. So Edith Louise has asked, she's obtained accreditation from completing alert program. So what units has she actually completed?
Edith, hi, nice to see you. If you've completed the full accreditation of upper limb and breast and lower limb and genital, is that correct? Yes. So you've completed already 4 micro units. So that's 20 credit points. So you're halfway there. And
so
then you've got,
yeah. I completed the wound management in December last year.
Yeah. Okay. So you've completed 5.
And
So
I joined the
3 more.
December one, coming December for the head and neck region.
So that's 6. So then you've got 2 more to go. There's going to be a competition to see who gets it first.
All right.
We've got about 10 students who have already completed 6 units at the moment, and they're waiting for the last 2 to come out. So you might be with them, Edith.
Okay, I'll watch out.
Louise is pushing the competition here. It will be interesting to see. It'd be great to have a good group of you at the first graduation to see that group of people come through who've done these courses so far. I've run through all the questions in the chat, but if anyone would like to post another one, or if you've got any more, please feel free to just pop your hand out and chat to us, whether it's about lymphedema. Yes, Jan, thank you.
When is graduation? How much time do we have, Louise?
So really, because our final unit isn't coming out till next year, it will, realistically, it's going to be the middle of next year would be the first opportunity. But as far as, formalising the unit, because we're playing with the big kids now in the university system, there needs to be a period of time where the central teams within the university make sure that all of the boxes are ticked and all of the units have been completed to be able to award the degree. Verity, you're much more aware of this process with the DPT program. So what are the sort of the timeframes, if you can elaborate?
So we have finally caught up from COVID, which took a while to do. So if you're a mid-year graduation, so if you have applied for your RPL at the beginning of semester 1, which is around January, February, then that degree would be awarded at the end of the semester, which is around July. And then you get invited to the September-October graduation ceremony. Whereas if you are in a second session sort of time frame, and we are still working through at the moment just how long that time frame will take and whether or not we can do almost ratification of the degree before the typical time frames. That's part of what we're working through with Central. But if it was a session 2 entry, that's around July, that finishes around November, then typically you would be invited to the March-April graduation. But you have the title of the award of the degree. So you've got your final transcript saying you have completed everything. That comes the moment that results come out. You just download that from the student system. So you would have that by July, but the nice testament to go up on the wall, that takes a couple of months to happen as that process. But as I said, you can always say, look, I'm going to be holidaying in Europe, and you can push it back if you're lucky enough to be in that situation.
I will also mention just about costs of the units. So in the micro-credentialing space, each of the units is $1,100, and that's across the board for the whole 9 units. And remember, you do 8 of them or get recognition of prior learning. Then if you've done those 8 units and you're going to then enrol in the postgraduate certificate, there will be a small fee, and I can't confirm just the fee, but I've been told it's relatively small, like $200 or $300 is a figure that's been sort of shared with me, to pay the university to make sure that they check off and everything's formalised, and to organise the qualification to be conferred.
We've passed that email on to Shelley. I think she might have a few things to send you as well, Louise.
Yeah.
Is there anything else which is burning for people in terms of questions, or even just, you know, there in the back of your mind?
I know we haven't had anyone ask questions about the clinical trials unit course, but I think it's also an excellent course, and we've had some wonderful experience with our clinical trials unit within our alert program. So as many of you know, we conduct research studies, and we've actually had some externally funded studies, so sponsored studies. They've mainly been some drug studies that we've actually worked in collaboration with the clinical trials team to engage their team in helping us develop the contracts with the sponsor for the study, to have a clinical trials study coordinator work with our team to do the data collection. So that's been an additional advantage for our team to get some of our research done in a really professional, knowing that it's under really good clinical practice standards. So I really think it's a great initiative. If you're working with anyone working in the clinical trials area, I would give a little plug to that postgrad cert in that area too.
Thanks, Louise.
So Yvette, you've just asked a question there about what's needed to complete the masters. So the same way you do RPL for your micro-credentials to get the graduate certificate, you then do RPL, which is the graduate certificate, to come into the masters. So that's then the 2 20 credit point units. So they haven't been developed yet. They will be before next year. But essentially what they're mirrored on is having that mentor in both the clinical and the research space. There will be some online content which will be quite bespoke depending on what you're doing. So there'll be some basic research methodology things to help upskill you again in your critiquing of different types of literature and those sorts of things around maybe ethics requirements, differences between different study types, because we imagine even, you know, a bunch of lymphedema therapists are still going to do very different sorts of research projects depending on your setting that you're actually working in. So there'll be that sort of content for you to work through. And then you'll have your mentor who, similar to what we do with some of our higher level postgraduate students who are preparing to be healthcare professionals, you have almost weekly or fortnightly meetings with your mentor where you talk through a particular project, which where possible will have embedded in your workplace just so it has that real authenticity for you and can help your practice. Where that's not feasible for whatever reason, we can certainly look at providing other options through some of the other, you know, opportunities that we have, such as at the alert program here at Macquarie. And then you plan out that project with your mentor. And then in that second unit, you carry out that project with your mentor. We don't quite know what the end result will be as of yet, because obviously we haven't done this yet. But I put it in the context when we're, you know, planning this and working on this, that it would be quite similar to what we do with our postgraduate, say, physiotherapy students or medical students at the moment, some of whom may go on to actually publish, many of whom will go on to be able to present at a conference on a project that they've done or do a poster at a conference, something like that. But also having that portfolio where really what you can do is show your skills and you can work through some of your most complex cases that you may have in your own clinical practice with clinical mentors in the space who really are up to speed on that contemporary evidence-based work, which is happening at the time. So it's different to, say, the micro-credentials and the courses that you would have done so far as part of lymphedema, but it's not like traditional university where you have your tutorials to attend or anything like that. It is very much a collaborative relationship with your mentor. Does that help at all, Yvette?
Yeah, thank you. The reason that I asked was that I got the opportunity to do a research project at work. And so I had my research mentor, and we went through the whole ethics and we've completed the program, and I've done the report, hoping at some point in the future I can publish it. And I just wondered if that could be utilised at all in that process, but it might not be able to, but just at least gives me some background on doing it as well.
It would certainly give you great experience. Those units are similar to other units though. So you can put in for recognition of prior learning. So if the work that you've already done meets the unit learning outcomes of those units, then potentially you could get that recognition for those. And we have had that in some of our other postgraduate health education degrees, where we've had students who maybe have been working as research assistants out in clinical practice and have published papers, and they've been able to collate sufficient evidence to show that they've been able to meet the criteria of that. So because it has a practice and a research component, there's a few different spaces there. Again, it would be a little bit of whoever was ready first would be a bit of that guinea pig potentially in trying to see what we can and can't make happen. At the same time, as part of that, you can't RPL part of a unit. So we can only give recognition for a whole unit. So even if you had the research component, we wouldn't be able to say, oh, don't worry about that. Let's just do the practice. So it's kind of an all or nothing process when we do recognition of prior learning. But it would stand you in excellent stead for whatever you wanted to move forward with if it wasn't something which could be RPL'd.
And I would add there, I'd
Thank you.
probably put in a little promo for our Master of Research degree, Yvette, which is a 1 year full-time or 2 year part-time research masters. And so we actually have about 6 lymphedema clinicians at the moment working on a research project. They're all doing it part-time, so over 2 years part-time. But that sort of project you've described to us would be probably something similar that we could formalise in a Master of Research. So you would probably get entry into the Master of Research in the second year where you're doing a project, and then we could work with you to formalise and, you know, do something or extend something that you've already done perhaps.
So Edith's asked a question about that as well, as to whether the project will be done individually or a small group. Often we have projects as a group of students on a bigger project, but individual students have their own pieces. So it will depend a little bit. Certainly if we had a couple of you from the same workplace and you were really keen to work on something there, then we could definitely work in a group. If you were doing something through Alert, then again, you may be able to work in a group. But even when they're a bit different, if we have similar methodologies just in different settings, those sorts of things will often get students together to do some of their mentorship together. I know a lot of my students and Louise's too, we work in kind of groups of 4 or so, and then we have times where we do that individual component as well as part of that mentorship, and you almost get a little bit more for the same amount because you get to get all the learning of the other students at the same time.
And if you were thinking, oh, I'd like to do that, but I have no idea what sort of a research project to do, we actually have lots of data in our Alert program. And so it could be something that we could do some, you know, analysis of data that we have collected that then you would apply into your clinical setting. So there's lots of opportunities to explore.
We got any other questions from anyone? Look at that. We are right on time of 6:30. That's amazing. Thank you all for attending. Thank you for your questions. Thank you to Louise and Rania for presenting today too. Liz has indicated in the chat already that we will have access to this as a recording online, and the team will be sending out some information around that to you as well. I understand, Liz. She may pipe in here.
That's right, Verity.
Thank you, Liz. So you will have access to that. Obviously, you've got the email address there too for Alert if you have any queries around that. If you have queries around clinical trials because maybe something has sparked your interest while you've been here and you want to have 2 graduate certificates, then please don't hesitate to reach out as well, because any of us can help you with these too. So we really appreciate your time and hope you have a great night. Thank you.
Thanks, everybody. Thanks, Verity and Rania. Thanks.
Bye-bye.
Bye.
Bye-bye.